Okay. I don't see myself either. I don't see my
Yeah,
picture, but that's okay.
just we recording, so you know. Everybody okay that we are recording?
Okay, sure.
Yeah.
Right. Need to tell everybody that we are recording. Oh my God! Everybody.
Hi, Mom. I see. I recently met this woman.
Yeah, because it's only just 2 minutes. You know, people still are joining.
So it's up to you, Racha. Like, you can call, but something what I do is that I try to start like at 5 minutes, later, like something like that. Try to keep it. But it's also considering your timeline.
Diana, you want us to wait a little bit more?
Yeah.
It's up to you because I will be telling people that we are recording when they join.
Mm-hmm.
It's still going on.
Mm-hmm.
Okay, good evening, everyone. I'm Rasha Amari. I wanted to thank all of you first for being here today for this event that we will be speaking about the pandemic and how it's affecting girls and women. I wanted to thank first all of you for being here and the Orange County chapter of the United Nations Association of California for having me today and giving me this opportunity to lead this event and discussion. The event will be an interactive discussion where each one of you will be able to share their views and opinion and interact together to know how you have been affected by this pandemic, share your opinion, and feel free to have the space to share it. So I specialize in gender equality and women's rights in the international sphere. And I will be speaking about how, as all of you know, that crises tend to intensify gender inequalities. I have been reflecting about how the pandemic is maybe making us go backwards in achieving the limited progress that we have already done towards achieving gender equality, either locally in developing countries or in developed countries too. We all know that crises tend to intensify gender equality, and also this crisis has caught us by surprise. Many women don't have the same opportunities as others. There are women living in extreme poverty, marginalized women, single mothers who will not have the same capacity to deal with this crisis as others. And we have all seen that in the first months of the lockdown and isolation measures, many governments have been alarmed by the reported cases of domestic violence. These cases rise, and we know about this because social media has been a tool to bring awareness about this. If not, this would be invisible. And thanks to this tool and other progresses through the internet and digital tools, we could know about these things. Also, besides this, there are also other factors as gender, age, race, the economic status, and social status of each one of us that affects our resources and capacity to deal with this crisis. So today we will be speaking about this and how women tend to suffer more from this crisis, and girls especially, and how they need to be at the center of the response to deal with this crisis. We will go from locally Orange County, how each one of you have been experiencing this crisis, and then we will be speaking about the United States, since sadly it's currently one of the countries that has the highest rates of deaths, and it's been affected really, really badly. So I want to take a moment to start for each one of you to introduce yourselves and speak about what you do and how you have been affected about from this pandemic, and how, in one sentence, to name a few consequences that you have been through. Thank you. You want to start, or anyone?
I can start. I'm Helen Nixon, and for me, of course, it's a limitation. You have to stay home, all the time, and then so actually for me, it's not really bad. I don't know why. I don't feel really trapped or something that I had to do outside the home, but I'm not able to do. I'm a stay home with my husband and my daughter, and for me, actually, it was a journey. I'm sorry, it's more than one sentence, but for me, is more going inward and finding myself actually, and then read books and spend time with my family. I'm sure it's not for everyone, but for me, wasn't bad experience so far. Plus, it's, it's not. It's so hard to not see your friends or not be active outside. But otherwise, I think I'm okay for now.
Well, I can go next. This is Sheila Cook with Zonta. And let's see, my position in Zonta is 2 years. And in the last few months, I have assumed the position of the District 9, which is the 5 Western states, and fortunately for me, out to Hawaii. My specific duties are advocacy. And my specific interest right now in advocacy is child marriage, and of course, all the nasty, horrible things that happen to women. Okay? Other than that, I'm glad to be part of this, and some of your faces I recognize. My face is not up there, and that's just fine, too. That's because of you. That's it. Thank you.
Okay.
So my name, I can go.
Mhm.
Let me actually reduce a little bit. I don't want to hear my own echo. So my name is Uhuru Tridal. I am currently the president of Orange County. I do have to admit that when I look back about previous relationships I had, I feel really lucky that I'm out of a really toxic relationship that I used to be before. And I cannot even imagine a person who be in a lockdown in a relationship that is really corrosive and has like a lot of not just physical but also mental abuse. I've been there, and I know how tough it is. So I'm really kind of in a point of analyzing how I was actually able to get out of that space, but that's not the same story for a lot of women. So that's something now that I'm thinking. And then on the other hand, I also have like one concern, which is actually from having family members in a different country. So then I think that a lot of us also experience that. And then even though, of course, the numbers are here hitting the US really bad, I'm actually really concerned for countries that they don't have the proper infrastructure and that they're going to start seeing the bad consequences that not just the economy, but also how the health and the medical system is going to start collapsing by the way that the numbers are going to start climbing up. So then that's my other concern that I have with some family members who are in Colombia.
Mm-hmm. Mm-hmm. Okay, thank you. Someone else would like to share?
Oh, that's me. My name is Diana. I'm also having relatives outside the United States. They're in Ukraine. So, yes, they are affected too, especially economically, because I don't know how my country is going to survive this economically. It's a really big hit even from the United States. So imagine for other countries that are not as rich, right? Okay. And personally, how I'm affected here, I gained weight. 10 pounds in 3 months just during lockdown. Very strange. I don't know if it's because of stress or because I actually was sick, but I did not have COVID. I had something else. Yeah, but I gained weight. So my gym is also like locked out, and we're supposed to stay home, not to go out, not to go to the beach. Yeah, so all those limitations affecting my health.
Yes, well, women usually they already have to carry the burden of working outside and inside the home, and with the lockdown measures and isolation, this burden have increased, and also some women have lost their incomes. And for example, for single mothers, this was a situation very difficult, especially also refugee people and vulnerable communities once face this crisis as other people. And we have also to take into consideration the fact that not everyone has access to hygiene measures or safe water, which all of us are. The government is always telling us we have to clean our hands a lot of times a day, and not all women have this access to these resources or the resources to protect their children, and their mental well-being is not safe, and economic security too. So which one of us would like to share more? If not, I can go to the next question. Feel free, any one of you, to share. Oh, I cannot hear you, Helen. You have to unmute yourself. I can't hear you. Okay, so
I can
Okay.
share. Is Helen back?
yeah.
I just want to add for the women that they have to stay home, take care of the kids, and because of the school is off, so they have to do homeschooling too. And especially for the small kids living in the small apartments, homes, and they cannot go out to the parks, to the beach. So it's really difficult for women, to do, as you said, all the burdens, on women, moms especially,
Yeah, also you can a good thing, because also in developing countries, not everyone has access to remote learning. So not everyone will have the same chances, and this crisis, it's intensifying the access of girls to education. Many girls won't be able to go back to school and keep facing barriers and challenges. It's going to intensify gender inequality more than before. So yeah, thank you for sharing.
Sure.
Sorry, Rima, you were talking before. You wanted to say?
Sorry.
Yes.
Yes, I do most of my work from home.
Mm-hmm.
Unfortunately, I used to do 10 to 12 speaking engagements a month in person, trying to end child marriage and human trafficking in California, but now has changed virtual, so I have Zoom fatigue. It goes from 8 in the morning till 8 or 9 at night. And I also had to have an emergency eye surgery in the middle of that.
Oh, wow.
So I had to basically, there was no lifting, no exercise. So I had to reduce my food intake drastically because I couldn't exercise. So I lost actually 13 pounds.
Oh.
Because if I knew that if I didn't do that, it's going to be really bad. I did that during law school, and I gained 10 to 12 pounds while I was going through law school. But it's, if I didn't have my dog, it would have been very lonely.
Oh, yeah. Well, I'm happy to hear that your eye surgery went well and you're recovering well.
Yes.
Thank you very much for sharing with us. Okay, well, if anyone shared, and I will go to the next question, which leads me to see, in your opinion, what can be done to address the impacts of COVID-19 on women and girls? Locally in Orange County, and of all. If you want, all of you can share examples or any examples that you have in your environments or circles. This is a discussion where all of us can interact and share our views as women to express ourselves.
I'm sorry, Rasha, I couldn't hear you very well. I don't know about other people. So can you repeat your question one more time? We have some difficulty to hear you.
Okay, sorry. I said, in your opinion, what can be done currently to address the impacts of COVID-19 on women and girls in Orange County and globally? If you can name a few examples that you have heard in your circle or your own opinion.
Mhm.
So anyone can share. We can always discuss about this topic.
So then I know, for example, again, I keep hearing this echo. And I want to reduce my volume because I don't want to hear the echo. Can you guys hear me good?
Yes.
Yes.
Okay, perfect. So then I know, for example, and this was actually really shocking to see how the numbers went up for aids that they were needed to feed women and the children who were actually sexual abuse, and they were actually taking shelter in the Orange County area. And I imagine also that it's the same case for the LA County. So then I know, for example, one of our partner organizations, which is actually Grandma's House of Hope, they actually run the numbers, and the numbers jump into almost 400% of the aids that they need at this point. So it's really crazy about how everything was really duplicated, quadruplicated in a way of kind of saying, like, for what you just mentioned, a lot of women, they lost their jobs. They were like probably in an environment that it was really not healthy for them and their children, so then they decided to leave. They're living in hotels, and they used to have this Nana program, which is actually drives around different motels in the Orange County delivering food, and then they start seeing that the numbers were popping and popping more. And I know that they have done different campaigns, and actually we in the Orange County chapter, we're actually trying to create more awareness and share this information in our social media and their website, so people can donate by eating food items or even money, so then we can actually even fulfill the things that are happening in our own backyard. Because I think we think about other countries, but sometimes we don't even realize we're experiencing here some problematics even in poverty. There are like a lot of families and people who are actually, they don't have even money to eat or paying the rent. So, and of course, the crisis was as accelerator. It's accelerating the bad habits and the problems that we were experiencing. There are now everything being exponential because of the virus.
Yes. Thank you very much, Isabel. Anyone would like to share their views and opinions about how to address this issue?
I just want to bring up the fact that there's a lot of static on the line. So I don't know who is it. So we can hear someone, there's background noise. So somebody needs to mute themselves.
Oh, yes. I think everybody is muted, besides Helen and Diana.
Do you want me to do that?
Let me mute everybody except speaker. Just every time you will unmute yourself, okay?
Okay, thank
you.
Way better. Thank you, Rima. Way better.
Thank you. Okay, anyone would like to go next? About how, for example, what they think about implementing a feminist policy where women will be at the center of implementing the recovery process and resilience measures. Or, for example, some countries have implemented that, where when there was an increase in the demand for shelters for women in the first months of the pandemic, they did have the funding to address this issue and resources. And for example, Spain did that, and also Canada, I know, did that. I would like to know your opinion about why do you think, for example, women should be in the center of addressing this crisis? We don't know if women, again, will not be having their interests and needs met. We have seen, for example, that women's leadership has been successful in leading this crisis in some countries like New Zealand, that we also, and Germany, and other countries like Norway. But women also tend, when they have leadership positions, they tend to be criticized due to gender norms and social norms, and they have to fulfill so many expectations when they do these roles of leadership. So anyone can share their views if you want about this topic.
Sorry, I was eating.
Oh, it's okay.
We just finished the summit. Sorry.
Okay.
I have, because of the uptick in domestic violence, 40% nationally and 30% in San Diego, for example, county. I have asked Assemblywoman Kari Petrie Norris to introduce a bill where they come up with instead of the victim of domestic violence or abuse having to call and the perpetrator may hear her, they will come up with a text where they can text, and this way they don't have to speak, and it's safer for them. So she is working on that. I provided her with all the information because one such murder was passed in the East Coast. So I provided her with all the information so we can have a similar legislation here that can help the victims of domestic violence.
Okay, thank you very much, Rima. If anyone wants to go next or share their views, they can go, or I will go to the next question. Okay, I'll go to the next one. What are the challenges and barriers that you are experiencing as a woman during this pandemic? You can name a few examples or speak about in your circle how you have been feeling and people that you know, friends and family. Thank you. Anyone can?
I can share, for old people. Actually, my parents live in Iran, and then for them, seeing their, grandchildren, family, friends, was really important because they have a limitation to go out, because of, their health problems. So for them, it was really, really harsh time, staying home all the time. Only my brother, did their grocery and then just give them, at the didn't enter the house, actually put them, outside the house. So it was really hard, especially the first 2 months. Now they're getting a little bit, going around, but it was really hard. I mean, as I said, the limitation, especially for old people or single mom, and people that could just walk around and take kids, to the park, near a beach or something like that, or just visiting family friends, and this is really time that people are just very isolated. To me, is isolation is for many people. So that's really hard on your mental, emotional. So thank God we can Zoom, but not everybody have access to Zooming or have cell phone, so you can call and you have see your family, friends. And so it's just most especially for old people and people who have health problems, just isolation, staying home all the time, and depression. I see a lot of people, complaining about, as my mom said, but like being depressed, and just watching TV, and because they don't know what's going to happen. They talk about the vaccine, but they don't know when it's coming, if it's coming, and how long they have to stay like that. And many people, like your country, getting sick because of the coronavirus in Iran too. So it's just uncertainty and just being really afraid, that the fear of getting sick and what so all the limitations they have, especially in hospitals. So yeah, that was the experience see.
Yes, thank you for sharing. Rima, you want to go next?
That background noise is still there. I don't know where it's coming from.
Yes, I think it's someone background. Now it's better?
Yes.
Yeah, it's better.
Okay, so I'm sorry, would you repeat the question?
Yes, it's. I wanted to know from all of you to interact. What are the challenges and barriers that you are experiencing as a woman during this pandemic, and name a few examples.
Oh, I haven't encountered any barriers, but the challenges were, in a sense, not being able to go myself. I didn't want to go myself to grocery stores, and so a lot of friends were bringing me the stores here. I mean, I will send them a list, and they will bring them to me. And then right now, I just go to Trader Joe's or to Mother's. I go in, I come out, and basically I don't spend any time. Most of the time, as I mentioned, is here at home on Zoom meetings, and so nothing, no challenges as far as being a female or anything like that. I haven't encountered that, and we have the option of going and walking. There's a lot of natural paths around us, so that is not an issue. But I know that a lot of my friends have to go in day out, day in to the grocery store because they have a larger family, and that's very concerning. I know a friend who she had both her son and daughter contract COVID because the daughter was a party and a wedding planner. And I asked her, where would she get COVID? Nobody's doing any parties these days. She said, no, there's a lot of people who are holding parties, and they are mixing, half of them with no mask. They're still hugging and kissing. And so I'm just surprised at some of the people that are not adhering to these rules, because they're not only endangering themselves, but the people around them. My nephew was telling me about his best friend whose sister-in-law decided to go get a tattoo. She got COVID from the tattoo artist. She took it home. Both parents had to go into the hospital. The father died and the mother recovered and came home. So people are not realizing how dangerous this is. And another friend whose father passed from COVID, he was in a nursing home. So it's all the challenges that I'm hearing, and the agonies is when a loved one dies here, is that because of COVID or any other issue, you're not able to go see them and be with them. These are the most, or going and comforting someone who basically lost a daughter because of cancer. We couldn't go and be with them at that time. So these are the challenges, but I think everybody understands, and but no challenges as far as being a female.
Okay, thank you.
If I can say something. Can you hear me?
Yes.
Okay. Hi.
Yes, yes.
So we talked about women pulling double duty when it comes to doing housework and working outside. And as the public and the private at this point, because of the quarantine, have kind of overlapped, those spaces are no longer separate. But there's another issue that I think a lot more women are essential workers as well. So you have a lot more women who are nurses. You have a lot more women who are grocery store workers, whatever, that type of jobs. And that also adds to the amount of danger and danger of the virus that they would be in contact with. And as they're performing the double duty of taking care of the household, then they're becoming this person who is either having to remove themselves. So a lot of nurses, a lot of doctors who are not going home. So they're not putting their family members in danger, for example. But also, and this is a little bit of a story, but we're clapping for all the essential workers at night, and we're accosting them as we see them at gas stations. My nurse friends when they're in their scrubs, are cussed at for spreading the virus when they stop to get gas. So add that, the behavior of the public to you when you are trying to then remove yourself from your essential worker position and then kind of do the duties that are basically assigned to you as the female in a household. So that.
Thank you very much for sharing. Yes, you pointed out a very, very important thing. A lot of women are at highest risk of infection because of their work, and also they don't have the option to work even remotely. They cannot, and they have to provide for their families. If not, they won't have any income. Many of them also, they work in the informal sector, so they don't have access to social protection. And also, we have to not forget the vulnerable communities. Not everyone, for example, in a country like the US has access to healthcare. So, for example, many communities are intensively being affected and hard hit by this crisis. And also, other communities are facing it maybe because they have the resources, they can face it better. So this is a very important thing to also keep in mind. The healthcare system, it's also not affecting everyone the same. Rima, you wanted to say something?
Yes, we also need to keep in mind that this COVID-19 is affecting certain communities more than other.
Yes.
Like the Hispanic Latino community, one out of 5 is affected by COVID-19, according to CDC. The African American community also is adversely affected. And that goes due to a few reasons. One is the economic opportunities, the jobs that they're working, and the fact that you have single mothers. And so it's all around, it's adversely affecting those communities more than others.
Yes, this is why governments should take this into consideration and fund those more affected people. For example, also professions like teachers, usually they're feminized professions where more women are working in that sector. Well, also the health sector. So they are at more contact with people. They don't have the option to even practice social distance. And we also, for example, if we take into consideration other developing countries where women, for example, live in extreme poverty and they live in slums, they cannot practice social distance. So all of them live in a small space where they are at a very high risk of infection and don't have the resources to fight this pandemic. So it's a very sad situation that many people are thinking will take us maybe backwards if governments are not taking seriously putting women's issues at the center of doing the recovery process.
I think
yes.
I think from my experience, we shouldn't wait for the government to provide these resources. We should demand that advocate that the government provides these resources, because if you leave it to them, they will never do it. So you have to advocate with elected officials in order to get this done for you. Otherwise, the government, and it's the squeaky wheel that gets things done. So we're 51% of the population, so we need to demand that these opportunities or better healthcare or healthcare for all, these all need to be provided.
This actually would have led to my next question, Rima, because you pointed out a very, very important measure to take into consideration. If anyone wants to go next to share their challenges during this pandemic, they can go, or I will go to the next one, the final question.
I'd like to share. Hi, everyone.
Hi.
I came in about 15 minutes late. Sorry. I'm so glad this discussion's being had. I actually had COVID pneumonia. It took me down out of work for 2 months, and I'm feeling better again.
Sorry about that.
My husband's a nurse in an ER, so that was back in May. And one of the things I want to bring up is just who's publishing on it, who's doing the research. There's been, when I first got it, there weren't a lot of people talking about symptomology online, especially for women. but then the people who are publishing about it are the men. But just that ability to communicate. I mean, I'll be honest, like the first week that I had it, that was very painful. My husband had it too at the same time, but I also had my period, and it was the worst I've ever had in my entire life. So that added on to just the regular symptomology that he was experiencing as well when we had it. So that was also something that was different being a woman. But I just wanted to highlight that, like, who's sharing their experiences and who's sharing their voices on a larger level for all of us to hear.
Thank you very much for sharing with us. And I'm really sorry you have been sick. I'm glad to see that today you're feeling better. And you and your husband, and I'm sorry you went through that process. Thank you very much.
Rasha, this is Sheila.
For sharing. Yes.
Yeah, if I just can make a statement, you know, I'm aware, as is everybody, the issues and the challenges and the problems. I want to pass on a couple of positive notes. For instance, I'm a diabetic, and my doctor, who I see monthly, she now does telephonic review of my health and my numbers and all of that good stuff. I don't have to worry about going in. She doesn't have to worry about me coming in. I think, gee, that's really positive. I was glad that she made that change, and she just did. Dentist, on the other hand, no, can't come in at all, you know, and to get my teeth clean. But for myself personally and my small family, we don't have a lot of issues and challenges. We all understand what we must do in order to keep ourselves safe. And we do it. Real simple. So that was all. I just want to add a positive note to some of the negatives that we all know exist.
Thank you, Sheila. Well, you know, also I wanted to point out the fact that there's a big gender gap in the digital sphere. In other countries, not talking about the US. Well, also in the US, there might be some women that they don't have access to a cell phone or internet to also even know the measures that they have to take to protect their family or children and how to be safe. Not all women have access to a cell phone in many developing countries, and that's a very, very important issue that governments also need to address and fund to address this issue. Anyone would like to go next too? No? Okay, and then I will go to my last question, and then we can have comments and final remarks. I would like to know a few ways, if you could mention, in your opinion, how do you think we as women can overcome these challenges from locally in Orange County, the area where you are based, and also globally, since all countries need to cooperate to fight this crisis? It's affecting all humanity. What do you think governments should focus more when they are implementing response policies to address this, considering the US context? Anyone?
I think organizations need to collaborate more. You need to amplify the voices of women. And again, you need to demand that things get done and better and quicker. For example, there's a rapid serology kit that's high in accuracy and specificity that's approved by FDA. It's $7 only, and you can get the results in 15 minutes. But nobody's jumping in order to provide it, and they keep saying, oh, we don't have the time, there's not enough kits. Well, you can't do the rapid PCR as a first step. You have to do it as the second step. Only if someone is positive in the rapid serology test that you go to the rapid PCR test. So that's creating the bottleneck and creating, and I just talked to one of the Congress members on this and the need to move, and everybody's saying, well, we're waiting for the president. I said, no, you can't wait for the president. You have to do it. You have to do it. You are in Congress. You're in a place of authority. You can take decisions. You can force the issue. And he indicated that the concern is from the administration is that if they provide all these test kits that the numbers are going to be up and they're going to be much higher than they are, which is not going to look good. But again, the women have to lead that, just like with Security Council Resolution 1325, where the women have to be involved in the peace process and the peace talks. Same
Yes.
thing now, we have to be at the table because otherwise we'll be on the menu. So.
Mhm. Yes, you're right. Thank you for sharing. Anyone would like to share their view about how women can be having their represented in this process when we are facing this crisis?
Well, I'll say something.
Okay.
Just you know, the level of death threats that women have had, our public health officers, a lot of our positions that women have fought to be in, now they're leaving due to safety, and just having more eyes on that and encouraging more speaking up about that,
Mhm.
in addition to what others have said.
I can add, just sharing information, as we do right now, we get information, we just sitting at home and we have access to the computers and, we can, as Rima said, talk to our congressman, or governor, call them, email them, and share the information, get the information. So for us that we can access to the information, I think is a good thing to do actually. And then I'm sure around us there are people like us that want to, talk about it and having good conversation with our friends, and then I'm sure, everybody can put in and, and then we come up with something and then we advocate. Even we are just staying home, but we can advocate, calling, emailing, stuff like that. So at least we can do something, even, we cannot go outside, face them, and then have like conferences or meetings like that. But this is a good area, I think, platform that we can, reach out to authorities. So, yeah.
Mhm. Thank you very much, Lalo.
Sure.
Anyone would like to go next and share their opinion? Anyone? No? Okay, then I guess we will go to the final section, which would be for everyone to feel free to share their comments and views or any suggestions that they have about this topic, about women being affected and girls differently from this pandemic, what they think. This was an event to lead an interactive discussion for all of us to share our views and perspective on this issue. So feel free to share and say any comments that you want to say. Anyone would like to say something?
Rasha, this is Sheila again. Sorry, I couldn't find the right button to speak.
Oh, it's okay.
Yeah, my sense is that women are much more productive, much more involved, much more understanding, and much more willing to fix a problem. Problem is we have a male government, as Rima says. Obviously we have government legislators that are very interested in fixing the problem, and that includes the president. There's not anybody around that I know of. I was speaking to a young man today who moved here from Spain, and I said, "Are you sorry?" He said, "No, because my grandmother and my grandfather both died just a month or two ago in Spain from COVID." So I'm not sure why I decided to speak up. I just wanted to say that I understand everything. I'm glad that you did hold this conference. I think this is very good. Next time I'm going to write down in advance what I'm thinking. And anyway, it was very nice to talk with all of you.
Oh, it's very nice to talk to all of you too. This will be a series where we speak about different topics affecting women and girls, from locally to globally in the context of the United Nations, since it's with the United Nations Association. So anyone can feel free to share their views. My interest and goal was to see how women are feeling and being affected and visibilize this issue, make it visible for all of us to be able to contribute and have a voice in this process, because usually we tend to not have a voice or be represented enough in these topics. And also now with the policies that are being implemented, women need to make sure that they have a seat at the table, like Rima said, and be in the design, implementation, monitoring, and evaluation, all the process of the policy response addressing this crisis. And also there's the need, it's very, very important to have data, collect data about how different communities are being affected. Girls, the factors of age, race, ethnic groups, migration status, and geographic location matters a lot in this crisis, because we're all of us being affected, but unfortunately not in the same way we will be able to face it. So these were my final thoughts. If anyone wants to share any other comments, they can feel free.
Yeah. How about coming up with a Google form that we can share with a lot of women and women organizations and ask them to complete it, so we can come up with our own statistics, that real life statistics, so it can be used when you go meet with elected officials and demand that things change.
I think it's a very, very good idea. I could start this Google form and start collecting data. I would love to have each one of you their opinions and views, like we did today in this session. It's very important for me that I had all of your perspectives from different backgrounds and views. So thank you very much for sharing it. And as I said, the data is very, very important, either to address domestic violence, which is not the only issue that we need funding for. It's also, it will be very important to address how this virus is affecting male and the male and female population, and how our backgrounds coming from different communities, it will affect us, because it might intensify the inequalities that we were already living before, which is very, very sad. It caught us, all of us, by surprise, and we're recently starting to adapt. I mean, wearing masks and with the new measures. So thank you very much. If anyone wants to say anything else, they can go.
I just want to thank Rasha and everyone. It was very nice seeing you all. And then after a few months, thank you so much for the opportunity. And that was really great. Thank you so much.
Thank you. Thank you to all of you.
Thank you.
Thank you.
And good night.
Thank you.
Bye.
Bye.
Thank you.
Thank you.
Thank you, Dana.
Mom. You're welcome.
Okay, thank you. Have a good night.
See you later.
Yeah, we have the recording of it.
Okay, bye. Thank you.
Bye.
Okay, bye. Bye. Thank you for attending the meeting. Diana, you have everything?
Yes.
Okay.
I'll send you like in 20 minutes.
Okay.
That means it's movie night.
Okay, bye. Thank you very much.
Movie night.
Bye.